A woman writes, I developed genital herpes years ago. I recently heard about medications that could keep me from infecting any future partners. Can you tell me more about that?
While there is no cure for HSV2, also known as genital herpes, there are medications that can treat and shorten outbreaks. Valtrex has been shown to reduce genital herpes by 70 to 80%. But remember, it's still possible to have an outbreak while taking the medication. However, the frequency of outbreaks tends to go down over time for most people. Valtrex is typically taken daily, and it can also reduce asymptomatic shedding, thus reducing the likelihood of transmission.
Dr. Lia, you mentioned a few solutions. How do they compare to one another?
For the treatment of genital herpes outbreaks, Valtrex, Zofrax, and Famvir appear to be equally effective, but Valtrex appears to be more effective at suppressing viral shedding when taken daily. Of the three medications, Valtrex is the only one approved for reducing the transmission of genital herpes. But it is important to keep in mind that Valtrex is not a cure for genital herpes, and there may still be contagious lesions or shedding that can occur while taking the medication. If your partner has an active outbreak, which means lesions and/or other symptoms, it's best to avoid sexual contact even if they're on the medication. It's also difficult when to know when an asymptomatic shedding is happening. So consistent condom use is a really important step to provide additional protection.